I have a secret IUD and need to undergo a non-invasive pelvic ultrasound. Will it be detected? I am pretty sure an IUD will show up on an ultrasound very clearly. I get the feeling that it doesn't matter the reasons why you have the IUD in terms of the retribution. I'd follow others' advice and postpone the ultrasound until you can have the IUD removed, or you can have a private ultrasound, potentially in the other country that you visit, lived in. Look after yourself. Depending on where OP lives, this can be a very dangerous situation for her. I'm an RN. Yes, the IUD will show up on ultrasound. If this is dangerous in your country, then postpone the ultrasound. It would be best to get out of your country for treatment. Lying about the reason for the IUD seems risky. I'd put up with the PCOS symptoms for now, until you can be treated safely. I'm sorry you're in this situation. I follow world news re women's rights especially. If there are no confidentiality laws to protect you and you can't keep your mother out during the procedure, then do not do the ultrasound. Since you're testing for PCOS, could you lie and say you got the IUD cause you thought it would help the PCOS-like symptoms and not for the birth control aspect? My mom got an IUD because her periods were giving her anemia. Try that excuse. Radiologist here. Yes, it will show up. Could you get your IUD removed safely and privately? Like in a non-Muslim medical center or with a discreet midwife. Make her come to your home as a girlfriend or go to the cinema with her. There is also material on the internet on how to remove your IUD yourself, and of course I would advise not to do it if you have any other option. But it could be an option. Getting into out is supposed to be very much easier than getting it in. Just make sure you have a backup plan if need be. Of course I am proposing this to you considering you are in a very urgent situation. Is there an option to call the clinic forward and make them made an excuse as for why mom's not allowed in the room, right? IDK if the physician would play the part. Sorry for this situation, babe. Skeptical smiley face. Mom can come but stay in the waiting room, right? Might be a good time to get COVID. It will 100% show up on the screen. IDK how old you are or what doctor-patient confidentiality is like in your country, but if they aren't protected and she cannot know, then make excuses until the cows come home, girl. It will show up on the ultrasound. I hope you can move away from the oppressive situation you are in. Good luck, heart. I recommend checking out the PCOS sub. Doctors are notoriously bad for treating PCOS, with there often being little they do. And the medical industry it's decades behind because they don't care to study women-focused issues. You might be able to find solutions on that sub. Many of us with PCOS focus on at-home remedies. The sub is quite helpful, so might be good if you're anxious about the response from your doctor. But birth control is often provided as a treatment for PCOS. So before the ultrasound you could mention things you've done so far. And say, I also got an IUD for PCOS, so it's not a secret. By being upfront about it, they may be less suspicious. But PCOS is definitely a reasonable explanation for having one. It absolutely will be detected. Whether or not your mother will be able to tell what it is, or if the tech will comment on it, is possibly another story. I don't have any advice for this difficult situation, but I just want to tell you that my thoughts are with you as you have to navigate this BS. I remember starting on birth control as a teen and being terrified that my parents would find out, and I'm from a pretty moderate, liberal family in the US, so I can only imagine the magnitude of how this would feel. I sincerely hope that this situation resolves itself painlessly, and that you're able to find a way out of your home country sooner than later. Stay strong, sister. Make excuses and go back to your former country at any cost, because it will show up, and you know the consequences better than we do. So why not walk away from it? You can't trust the doctor or mom. Avoid the ultrasound. Ask yourself, what will happen if? You have to prepare for the worst. Good luck. One of the treatments for symptoms of PCOS is the use of an IUD. If the topic of the IUD is brought up during the ultrasound, tell the doctor and your mom that was a device the doctor implanted while you were abroad because of your periods being heavy and frequent. Tell them you don't know what the device is called, but it helped. As everyone is saying, do as much as you can to postpone, delay this. Get COVID, vomit up stuff, stomach pain, headache, nausea, vertigo, etc. Delay as much as you can until you are able to leave or find some other way out. Keep us posted. I am so sorry. Do you have any friends in your previous country that could help you get back? I would imagine the whole reason that you're being assessed for PCOS is because your parents want to marry you off. If you do find yourself in this type of situation, you might be able to seek asylum in another country. Please keep talking with your contacts in previous country. I got PCOS detected by blood test, hormonal. If you are in physical danger, you should do what you can to avoid this exam.
If you enjoyed this video, please check out our playlists full of similar content. TooAfraidToAsk is like doom scrolling for your ears. Please like, share, and subscribe.